We're back now with our series, The Cost of Denial, where we investigate the challenges people face with insurance coverage. Tonight, should insurers cover weight loss drugs? One CEO is speaking out to our Ann Thompson, saying they cost so much he had to lay off hundreds of employees.
Joe Cashone is CEO of the largest health system in the Philadelphia region. Jefferson has 33 hospitals, 700 care sites, a university and prestigious medical school, its own insurance plan, and 65,000 employees. But after a big financial loss last fiscal year, Cashone had to cut jobs.
About $180 million of our loss was in the insurance plan last year.
And how much of that $180 million is attributable to GLP-1s?
The pharmacy costs were a huge part of that, and I would say probably about a third of that $180 million were relative to the GLP-1s.
Wow.
Yeah.
That roughly $60 million loss, part of the hard reality. As more and more Americans use GLP-1 drugs to lose weight, some companies like Joe Cashone's that cover the cost of them are losing money.
As a doctor, I mean, we understand that these are an important breakthrough in medicine, but they are expensive. As the CEO of 65,000 employees, we've seen a dramatic increase in the number of employees that have gone on this, so it's added to our expenses.
Isn't it ironic that you have a healthcare system that knows these drugs work, but doesn't want to pay for them because they're so expensive?
Yeah, I think the system wants to pay for them. It's just that we can't afford to pay for them right now.
Last year, Jefferson covered the cost of GLP-1s for employees and members of its insurance plan.
You had to lay off over 600 people.
Mm-hmm.
Can you draw a direct line from the explosion in the use of GLP-1s to those layoffs?
You know, I think all these things impact. I will say that the GLP-1s in our health plan last year had a huge impact. I don't know if it's one for one, but it is definitely has had a significant impact.
So like many other CEOs, Cashone, a cardiologist by training, decided to dramatically reduce coverage of these popular drugs. This year, employees have to take new steps to qualify for care.
They have to actually go through a stepwise progression of diet, exercise, and then only if they fail those will they be able to get us to pay for their GLP-1s.
Oh, I think it's
restrictions that he says have saved Jefferson $20 million so far.
There are many that argue that the cost of GLP-1s is actually lower than the long-term costs of treating cardiovascular issues, cancer issues. What do you say to that?
There's no question that they will have a return on investment. But who pays for them in the year that you deliver them? So let's just say it costs $15,000 for the year. Who pays that $15,000 so I can save money 10 years from now?
And Ann joins us now live from our Washington bureau. And this is not an isolated case. So many companies are making changes like this now. So what's the solution?
Well, Tom, Jefferson is just one of many companies that are limiting their coverage of GLP-1s. And while top manufacturers have taken some steps to bring those prices down, Cashone says it's not enough to cover them the way he was. Tom?
Ann Thompson for us. Ann, we thank you. And we're back in a moment tonight with the husband of the woman missing in the Bahamas. And he just left the country despite saying he